Hello, my name is Austin. I'm representing the group Room for Four for our audio presentation on trichomoniasis. Trichomoniasis is a sexually transmitted disease that is caused by the organism Trichomonas foetus. This organism primarily affects cattle, however, humans can also be affected. Furthermore, this organism has been identified in the nasal passages of pigs and the gastrointestinal tracts of cats. In bulls, the organism is housed mainly in the sheath, as we rarely ever see it further in the reproductive tract. Bulls maintain this infection for life, however, a cow or heifer can rid of itself within the infection within 3 months while maintaining abstinence. Cows and heifers will possess a short immunity once they rid themselves of the infection, however, they will be successful within the next breeding season. Trichomoniasis is a one-celled animal called the Trichomonas fetus, and both the dairy and beef cattle are affected. The bull deposits the semen in the vagina of a heifer or cow, and the infection matures over 3 weeks. It can also be transmitted through AI, but it's a very small chance. The clinical signs and outward symptoms. There will be a slight reddening and swelling of the vulva and the walls of the vagina. Discharge from the vagina is of a greater quantity and more watery than usual. Some irregularity in heat patterns occur, and experts can't agree on if bulls show symptoms or not. No symptoms are distinctive or consistent enough for a definitive diagnosis. It's been an endemic in the USA for over 80 years. The percent of herd infected or percent of animal population infected is undetermined and unknown until the herd is tested for signs of the infection. The STI is a worldwide distribution. Mississippi and all the states west of the Mississippi River, except Iowa and Minnesota, have rules and regulations to reduce the spread of the disease. Percentage of infected animals within the herd largely relies on how many bulls you have infected, as they are the primary transmitter. Cows can infect bulls, however, this is not nearly as prevalent. Trichomoniasis vaginalis is a parasitic protozoan that infects the urogenital tract and requires iron as an essential nutrient. Iron is known to upregulate various adhesins required for cytoadherence and other factors involved in pathogenesis. At mucosal surfaces, iron is chelated by lactoferrin, resulting in low levels of free iron. However, pathogens have evolved mechanisms for an increased uptake of iron. Bovine trichomoniasis is a sexually transmitted protozoan disease. This organism lives in the reproductive tract of a cow and the sheath of the bull's penis. The primary mode of transmission is from sexual contact during the act of a bull breeding a cow. Most often, the first clinical sign of trichomoniasis in a herd is an increased percentage of open cows or late cows at the fall pregnancy check. If fall pregnancy checking is not done, clinical signs in the herd are reduced calving rate and a calf crop that is strung out over 3 to 6 months. On the other hand, bulls will show no signs of disease at all, but can easily shed the organism indefinitely. There are systemic effects in the bull, including discomfort in the penis, painful urination or ejaculation, discharge, and the bulls will be less likely to mate, which will reduce your calf crop. For treatment, there are various imidazoles, which are common to treat fungal infections and has been used to treat bulls, but is both safe and effective. Ipronidazole is an antiprotozoal drug and is probably most effective, but due to its low pH, frequently causes sterile abscesses at injection sites. In addition, bulls are probably susceptible to reinfection after a successful treatment. Prevention consists of eliminating the infection from the bull battery by culling all bulls and replacing them with virgin bulls, or by testing and culling positive bulls. Repeated testing in older bulls may be unsatisfactory, and it may be prudent to cull them all. In cows and heifers, infection lasts usually around 3 months post-breeding with sexual rest. Immunity in cows and heifers can be given for a short while after infection. However, it doesn't last long. Cows can be reinfected the following season. Bulls are normally affected for life. Young bulls are less susceptible. Cows is relatively high due to reduced calf crop, lower weaning weights, decreased milk production, abortions, but that's a smaller chance, poor pregnancy rates, and pyometria, which is also a small chance. There is a formula to assess how much money you can lose due to trichomoniasis. And you take the number of cows bred times the percent of produced calf, and that equals the normal expected number of calves to sell. The number of calves to sell times the percent lost due to trich equals the number of calves lost. The number of calves lost times the estimated market value equals the number of dollars you lose. The economic impact by trichomoniasis is a relatively large one. It is very important not to allow this disease into your herd, as there is no treatment available for bulls once infected. And that is it.